you hear people talk about evil in someone's eyes, like he looked through me like I wasn't even there. And I remember him putting his hands around my throat and like thinking like, I'm going to die.
When we think about the first picture of a domestic violence victim, the kind of classic iconic image of a battered woman is a woman with a black eye, right? Which one of the things that I realized now in the context of this work is she very well could have had a concussion in the context of that black eye, but it is something that none of us in the field have thought about.
And I don't remember much after that, but a nosy neighbor saved my life. Like somebody had heard all the stuff going on and knocked on the door, and that was the only reason I'm still alive.
And how we hadn't, it's one of those things you say it, you look at the data, we talk about brain injury and hits to the head, and it becomes very obvious very quickly. But even in my role at my organization as a statewide leader, having led a trauma-informed initiative across the state, trained in other states about the work that I was doing, never once had I mentioned brain injury. And how did we manage to miss that?
81% had reported being hit in the head. 50% or so many times that they couldn't remember. And 83% of the survivors working with the organizations reported that they had been choked or strangled so that their brains had been deprived of oxygen.
And the sad part for me is I'm an EMS educator. Like I teach trauma. That's like one of the things I love. And yet, even though as much as I know about trauma, I totally missed the strangulation part, the brain, and the effects that it's had on my body.
Many survivors who have been living with unmet need regarding brain injury intervention for a long time do end up developing comorbid issues like mental health issues and substance use issues, struggles with suicide. So unless we're identifying the underlying brain injury early, there can be other long-term health impacts for survivors of domestic violence who are not receiving the services that they need.
At one point, I attempted suicide. And so it was like, if they would have found this earlier, like, you know, my family has watched, my friends and family have watched me, you know, try to end my own life and stuff. And it's like, that all could have been avoided had the right people had the right knowledge.
This has just kind of changed how we think about things and how we want to do things. And we're very, very hungry for helping us tackle this, because this really hasn't been tackled in this way before, and helping us from a practice level figure out what this needs to look like in the very complicated, very challenging work that domestic violence agencies do.
Sometimes it's what we can't see, things that lie under the surface that are the most dangerous. Take a deep breath. And what do you notice?
Sometimes you don't see an injury that's happening to a person on the outside, but it's just so much going on the inside. I'm going to tell my story in as many words as I can remember, because sometimes I have a little trouble with keeping it in a chronological order.
After 22 years, Tahita Jabbar is still struggling with the long-term effects of injuries received from her abuser.
There's really something going on. I'm feeling it's almost like I'm being taken back to when this first happened. I'm feeling the fuzziness in my ears, and I'm feeling the vision is blurry. There's something going on.
Tahita is a survivor of a traumatic brain injury brought on by beatings from her ex-husband.
And so that day, when he beat me upside the head, I left the children outside, and when he finally was done with the beating, I just crawled up the stairs and went and got in my bed. And I'm sure it must have been 2 days that I just had to lay still. And I couldn't go to the emergency room. Number one, I didn't have insurance. And I couldn't go to the emergency room, number two, because he wouldn't have allowed it.
Domestic violence continues to be an epidemic in our society. 1 out of every 4 women will experience domestic violence in their lifetime. Domestic violence beatings can lead to traumatic brain injuries, injuries that can impair cognitive functions.
A traumatic brain injury is a blow, jolt, or penetrating injury to the head that interrupts normal brain function.
Such injuries can lead to severe problems, such as memory loss, early signs of dementia, even loss of life.
More than 100 people die every year as the result of domestic violence in Arizona.
There is no doubt that domestic violence is dangerous. Law enforcement is working with the community to end domestic violence and make the community safer. In particular, traumatic brain injuries are a concern to us.
Survivors of domestic violence face a difficult and confusing time, which can be made more difficult by the presence of a traumatic brain injury.
Traumatic brain injury has been linked to domestic violence. Blows to the head, a bullet from a gun, shaking someone violently, even strangulation are just some of the causes of traumatic brain injury inflicted by an abuser.
And he grabbed me by my hair, he threw me upside the wall, and then he pulled me back by my hair and he started beating me in the head with his fists. And I tried to muffle my screams, but he was hitting me so hard, I started screaming. So the children ran up to the door, and I'm telling them, go away, you all go play. And I tried to kick the door shut so that it would be muffled and they couldn't hear what he was doing.
A traumatic brain injury impacts a person's ability to function in 3 major ways: physical, cognitive, and emotional behavioral. From a mild traumatic brain injury and concussion standpoint, the most common physical symptoms are going to be headaches, dizziness, and balance-related issues. From an emotional behavioral perspective, the most common issues are going to be related to increased depression and anxiety. And from a cognitive perspective, which I think is the most important perspective to talk about specifically with this population, is memory, attention, concentration, and speed of processing.
This extremely violent abuse can have far-reaching and long-range effects. Some of the injuries are readily apparent. Others are buried under the surface, hidden, but still dangerous and debilitating to victims.
Unfortunately, traumatic brain injury can't always be seen outwardly. So it's not like somebody's wearing a Band-Aid on their forehead that says, "Pardon me, I'm forgetful, I've had a traumatic brain injury." So it's really important to just stay mindful that this is a significant issue that impacts individuals with domestic violence. And when interviewing or interacting, it's, again, just important to kind of keep it in the back of your mind that traumatic brain injury may be something that impacts their ability to function.
It gets frightening. It's fearful when you can't remember, you forget things, and you know that this is something that's not of your nature.
Domestic violence and traumatic brain injury affect every community, and it's important to work together to end both.
The Maricopa Association of Governments Regional Domestic Violence Council is made up of law enforcement, prosecutors, victim advocates, and elected officials. It is their mission to work collaboratively to end domestic violence in the region. The council has worked to develop a list of recommended police practices or protocols that can be adopted by law enforcement.
Domestic violence is being addressed by police officers in taking up the protocol model, utilizing it within their departments, which gives some consistency across the region in how domestic violence victims and offenders are treated.
Domestic violence investigations are complicated, and the presence of a traumatic brain injury can make communication with the victim more difficult.
When law enforcement interacts with victims of domestic violence, they need to be prepared for a traumatic response. Victims may appear escalated, agitated, and non-cooperative. They may have difficulty creating a chronological timeline of the event. With traumatic brain injury, the difficulty to create that timeline may be more apparent.
When the officers arrive on the scene, that because of what I went through, I was vulnerable, I was emotional, I was in pain, I was embarrassed, I was scared for my children's welfare. So I think that the officers have to be a little bit more aware of the story that she's telling you may not jive with what the chronological order that you feel that it should be, that this story should take place in. But that's what happens when people have traumatic brain injury.
By better understanding TBI, or traumatic brain injury, a law enforcement officer has a better idea of what they're looking at when they respond to a domestic violence.
Things like difficulty with memory and their attention and their concentration, and especially when it comes to being a historian or being compliant. Cognition is going to be something that impacts that person's ability to perform in that environment. So it's important to be mindful of not only the emotional component of being a victim, but also the cognitive end of things as a result of their traumatic brain injury, from being able to answer questions to being able to follow directions.
So officers need to exercise a lot of patience. Officers need to be understanding. They need to demonstrate a kind, caring, and compassionate type of attitude, and make sure that they're aware of possible issues or concerns that may be going on with that victim, that maybe they struggle with understanding at the time, but if they slow down a little bit and give the person enough time to communicate and look for certain signs and symptoms that may be an indication of some additional injuries, I believe that would be a great assistance to officers in completing these types of investigations.
One tool officers use to better communicate with victims are lethality assessments. Lethality assessments involve a list of questions used by police or victim advocates to identify victims who are at greatest risk of being killed.
A lethality assessment is something that gives the officers and the investigators a better understanding of possible history that's involved in domestic violence type situations or the potential of future violence. Looking at the history of lethality assessments that have been conducted by law enforcement agencies, it has proven to be a very productive and useful tool for law enforcement agencies.
It's being used by prosecutors in a consistent manner, which also allows for that same treatment throughout the region.
One of the things that we're really proactive on, and that is training our officers to be able to identify certain signs and symptoms that domestic violence victims may be going through, and then use that as an assessment for their follow-up investigation and information that will be forwarded to the investigating detectives to further assist them with completing the investigation.
Lethality assessments can reduce repeat domestic violence calls to the same household, increase safety for law enforcement and victims, help prosecutors when charging offenders, and offer hope for preventing domestic violence fatalities in the future. Conducting a lethality assessment and taking the time to listen are two very important tools officers can use on the scene.
There has to be a follow-through, there has to be a follow-up, and there has to be sensitivity, and there has to be, officers have to be aware of the emotions that the traumatic emotions that this person is going through. I think that you do have to be more sensitive when you come into a situation of domestic violence with a brain injury or a head injury than any other situation that you come into, because I couldn't think, I couldn't feel, I couldn't remember, I couldn't see. And I believe that that's true for most people who are going through that kind of a situation.
Probably the most important thing is to put yourselves in the shoes of the family that is dealing with the domestic violence. Only then can you really fully understand what they're going through.
Besides conducting lethality assessments, officers can go one step further. They can connect victims with advocates. The advocates play a critical role in following up with victims of traumatic brain injury to make sure they are getting the help they need.
There are many great resources available to victims of domestic violence, and police can be a great asset in helping victims to connect to these resources.
There are also many services available for survivors, such as counseling, shelters, hotlines, and support groups.
Take a deep breath.
Mike Hutt works at Chrysalis, a domestic violence shelter. Its mission is to transform lives by giving survivors the tools they need to succeed and feel safe. Hutt works with survivors using a therapy called eye movement desensitization and reprocessing, or EMDR.
So the light bar is used in EMDR, and it's one of many forms and ways to treat trauma. We ask the clients to think about the traumatic memory that's very distressing to them, causing them current difficulties. And when they think about it and track the lights, they begin to integrate pieces of their memory and discharge some of that emotion. It feels less distressing for them. So that way they could function and live a more free life from their trauma.
Tahita is a survivor, and although she is still being treated for the beating she received 22 years ago, she has made great strides physically and emotionally. Today, she is giving back to the domestic violence community with her own organization, SWAN, which stands for Someone Worth Accepting Now. It helps survivors get back on track with their lives and regain self-esteem.
That there is life after someone treating you like dirt, and finally, I can work with other people who feel that way and let them know that you are not dirt. It doesn't have to be that way. You can do. If I can do it with my 9 children, you can do it with what you have, and that's one of the biggest boosts. So ego. I mean, it's just great. Just great.
If you are a victim and you feel you are in danger, please call 911 or the National Domestic Violence Hotline at 1-800-799-7233. For a map of local victim services, go to www.finddvservices.com. Everyone plays a role in ending domestic violence.
Domestic violence is a problem that affects all societies, all walks of life, rich, poor, it doesn't matter. Our job as a society, as a council, is to end domestic violence.
People have heard of PTSD or post-traumatic stress disorder and are at least somewhat familiar with what that might look like when somebody comes home from war or, goes through a really horrific event like, that's potentially life-threatening. What I think many people are not aware of is a separate category of PTSD, which is called complex PTSD. And I want to explore that a little bit in today's video. This is something that I feel really strongly about. I've done a lot of work with people with this diagnosis, and it's tough to see the pain that they're in when they present for treatment. And so I'm going to spend a little bit of time talking about symptoms and what that might look like, but more importantly, I'm going to speak to the experience of sitting with somebody who is going through this and what it really might present as in the room or when you're in front of somebody. What is the difference between post-traumatic stress disorder and complex post-traumatic stress disorder? I think this is such a great question and something that there's a lot of confusion and even just not awareness around. And so the main difference between the two is that often PTSD is one distinct event, or maybe a series of events over a small time. So you're serving in Iraq and you're in this war zone and you see some really horrible things, and you come back and then you're diagnosed with PTSD. And that has a certain look and a flavor to it. With complex PTSD, this is a person who over years has experienced several traumatic incidences where they feared for their own safety or the safety of someone they loved. And so, as opposed to one discrete event, this is a series of events over, years that gradually accumulate to the point where the individual will present with symptoms of PTSD. And these symptoms are often more severe in some ways, and we're going to talk a little bit about that next. One of the most difficult things about complex PTSD is that the trauma that people go through is typically of an interpersonal nature. And so this is things like, abuse from a parent or sexual abuse. And so, but this occurs over and over and over again to the point where the individual really loses a sense of safety and trust in others. And so much so that we're now understanding that there's a huge connection between adult physical health issues and some of the mental health problems that come from being raised in an unsafe environment. And unsafe doesn't have to be physically unsafe. It can be psychologically unsafe. It can be emotionally unsafe. And so we're going to talk a little bit in the next segment about something called the ACEs, which is the Adverse Childhood Events Questionnaire. In the last segment, I mentioned the ACEs, which is the Adverse Childhood Event Survey. I think I said questionnaire, but it's actually a survey. And this consists of 10 questions. And the nature of the questions are around early childhood experiences of lacking safety in the home. And this can be things like, one of the questions is, did a parent ever physically harm you? And it goes into specifics of what that would look like. It's a sensitive questionnaire, and so I don't want to trigger somebody unnecessarily. But the questions are around things in the home environment, around alcohol use, individuals going to prison, physical safety, having your physical needs met. And it's 10 questions, and however many questions you answer yes to, that's your ACEs score. So why is this important, and why are we talking about this? One of the most interesting things to come out of this survey was the connection between these early childhood experiences and later serious physical health problems in life. Things like diabetes, fibromyalgia, mental health issues, anxiety, depression. And so there is definitely a clear correlation between how safe you were as a child and what your outcomes are as an adult. And we're going to wrap this around back to complex PTSD in the next segment. But I just wanted to mention that people experience trauma in different ways. And there can be individuals with a very high ACEs score who don't end up having PTSD or complex PTSD. Their pain and suffering manifests in the form of physical issues later in life. So trauma pops up in all kinds of ways. And we can't always predict what that's going to look like in any given person. One of the recent findings about complex PTSD, and this is just a little aside, but complex PTSD is not a separate category in the DSM-5, but it is in the International Classification of Diseases, which is basically what healthcare providers across the world use to diagnose certain conditions. And one of the things that has come to our attention is that complex PTSD is often misdiagnosed initially as borderline personality disorder. And that's because some of the behaviors that individuals with complex PTSD present with are similar, not the same, but similar enough to borderline personality disorder that it results in this confusion. I hope you found this video helpful and interesting. If you did, please like it below and feel free to subscribe to our YouTube channel, where we're going to be producing
that is called the AIMS, the Abnormal Involuntary Movement Scale, just to see whether you have some of the movements that have been described to me. So please do exactly what I'm doing. Tardive dyskinesia is a set of involuntary movements which are irregular and choreative form. So they are smooth and writhing, and they're involuntary. People don't want to have them. They are distinguishable from tics, which are fast and also